So this video deals with PBL. A lot of times in the interviews they ask what's pros and cons of PBL, and most of the time most med students or applicants are not even aware of what PBL actually is. So we'll just talk through what PBL is and then the pros and cons. So PBL is simply what's called a case-based discussion. So usually we have what's known as intro and outro sessions. For example, when I was at university, on the Monday we'd have the intro session where we're introduced to the topic for the week, and then on the Friday we'd come back and rediscuss. So the case-based discussion involves a case on a particular topic, for example asthma. So you'll spend the Monday or the intro case discussing what asthma is, and then you develop what's called ILOs, so intended learning objectives, which are objectives that will be based on what you think you need to learn about asthma. So this would be discussed as a group. You'll come together, so you'll usually have maybe 10 people, so obviously each university has its own numbers. So in my case, typically we'd have between 8 to 12 people. So 8 to 12 medical students, you're discussing together what you think you need to learn about this particular topic. So you develop your ILOs, and you're supervised by a tutor. So it might be a doctor, it might be someone who works within the university, like a lecturer, somebody who is involved in research. So it could be anyone, but someone who's in that medical medical field. So they supervise you, they help guide you to a degree, but largely it's dependent on the students themselves to come up with these ILOs. And then on your outro sessions, you will then go and discuss what you've learnt based off these ILOs. So in between the intro and the outro, you go home, you read up on your ILOs. So if one of your ILOs is learn about the pathophysiology of asthma, go home, find some textbooks or something that will discuss the pathophysiology, and then you make your notes, study it, and then on the outro session you then, as a group, you discuss all your ILOs and what you've learnt. So what are the pros and cons? So let's start with the pros. The first thing would be independence. So what they like to do in medical school, those who promote PBL or utilize PBL, is they like to create independent learners, because medicine is lifelong learning. You always have changing guidelines. Some lecturers, they'll tell you that every 10 years, half of what you learn in med school, or what you learn in med school in 10 years time, half of that will be proven wrong. How true that is, I can't say for certain, but the guidelines are constantly changing. So they want to promote this mentality of you're constantly studying on the go. You're not relying on someone else to tell you this is how things are, this is how things should be. You're able to find out yourself through your own research. So then there's teamwork. So because you're working as a group, obviously involves you having to work as a team to come up with objectives. So it develops that ability to work with other people, which is part of what being a doctor is about. So as a doctor, you work with the MDT, what's called the multidisciplinary team. So this involves doctors, pharmacists, nurses, HCAs. There'll be other specialists like the physiotherapy team. There's loads of people involved in a hospital and in a GP. Then you have other people like your ward clerk who deals with paperwork, referrals and stuff. So your overall admin team, you have the IT team, many people. And so this working together with other people promotes that mentality towards, or that approach towards the MDT. So obviously if you're working with other people, that will also develop your communication skills as well. Coming together to discuss certain ideas, learning to listen to other people's viewpoints, because sometimes what happens is, because science is not an absolute, like you have maths which are proofs, but then science, there's a lot of hypotheses, there's a lot of theories. So someone might come with an idea and then someone else comes in with an idea that contradicts. So then it's just coming together to discuss these things, come to either an agreement or you agree to disagree. Hopefully your tutor will be able to help you out in that situation. Then you've got leadership. So with PBL, usually for the intro session, you'll have one person, or the intro and the outro for that week, you'll have somebody who's going to lead the case. So their job is basically to make sure that everyone stays on track. People are working together. There's no, people aren't talking over one another. People are listening to one another. Making sure that the ILOs are appropriate for the topic. So it's unlikely this would happen, but let's say we're talking again about asthma, then someone wants to study something about some other disease that might be related to the heart. So it's the leader's job to acknowledge that this isn't really part of the asthma topic, so we shouldn't really study that. Obviously it's difficult when you're still in the early stages of medicine, but really what they're focusing on is just your ability to lead a team, because as the doctor, as part of the MDT, even though you're working as a team, you have the ultimate responsibility of the patient, and you're the one that's going to lead that team. Okay, so now I talk about cons. So the first thing would be the ILOs. So when you establish ILOs, you're obviously doing it based on what you and your team think should be appropriate. But the issue there is they might not be appropriate, and you might be heading down ILO paths that might not be relevant to what actually comes up in your exams and what you actually need to know as a doctor. And your exams are set out by your examiners, which is not based on what you come up with in your own ILOs. Now, my university did give some ILOs for things like anatomy and for these cases as well, but oftentimes the ILOs are quite vague, so even then it's quite difficult. Whereas if you had, for example, a lecture, so we did have a few lectures, but universities that don't use PBL, just purely lectures, and your exams will obviously be, because they're set out by these examiners who are giving these lectures, the exams are obviously going to be based off what comes up in these lectures. So whatever comes up in the lectures will come up in your exams, not really what you're covering in your ILO per se. Obviously there's going to be some overlap, but the point is, if it's purely lecture based, then if I just go through these lectures, then I should be good for the exam, or you will be good for the exam. Whereas if you just cover your ILOs and you don't have lectures, some of what you may spend a lot of time covering may not come up in the exam, because the examiner or the lecturer doesn't deem that relevant to your learning. And so it's a case of, how do you know what actually is relevant and what isn't relevant? And your supervisor might not necessarily be a specialist in that field, so they may not actually be able to tell you themselves what is relevant, what is not relevant. And another issue is, because each individual is going away and doing their own learning, as opposed to a unified lecture from an examiner, because each individual is doing their own thing. You might come back and you've covered one thing, someone else has covered something else, so it's quite difficult to cover everything comprehensively when you're setting out ILOs, as opposed to when someone just gives you what you need. So that falls into the whole, you're not being spoon-fed the appropriate material, you're not just being told what to do. And sometimes when you're covering such broad topics, it's a lot easier just to have someone tell you, learn this. And of course it's very time consuming as well. Many of these books, they go into excessive detail. A lot of the detail you don't actually need to know. They cover so much of these. For example, in asthma again, they'll go into all these genetics, things that you as a doctor, unless you go into research in asthma, you'll never touch these things, and you'll probably never hear about these things again. And so it can be quite time consuming to find the appropriate material for what you actually need to learn for your exams, but also what you'll need as a doctor. So that's pretty much it for pros and cons. As long as you cover these things, it's not really, those are all the pertinent points.